femoral shoulder adduction. I need to measure that. And then it also is going to say right elbow flexion being a muscle test. So I'm going to come up to my patient and I'm going to say, hi, my name is Anita Killens. Nice to meet you. I understand you're having some trouble with your shoulder today. Yeah, your left one? What's going on? Well, what I'd like to do is check how you move your shoulder so that from one treatment to the next we can kind of tell if we're making some progress. Would that be okay? Right, I'm going to use this little piece of equipment called the goniometer, and I'm just going to measure it. It won't hurt, and I'm just going to put it over your skin. Is it okay if I have a look at your skin today? Okay. I'm probably going to be kind of poking around on some bones, but nothing will be painful, okay? Right, are you okay to lay down today? Okay. Let's go lay down on your back and put this pillow under you. Good. I'm going to go ahead and raise up your sleeve. Is that okay? All right. All right, what I'd like to see is first how you move your shoulder. Can you go ahead and lift it up like this for me? Okay, thumbs up. Yeah. Is that as far as you can go? Okay. Come down. All right, so thinking. Click on this one right here. Okay. All right, go ahead and lift it again. As far as you can go. It's okay if I let go.
Okay, so what's the axis of your measurement?
It's acromion.
Okay, and where do you have your stationary arm?
Lined up with the sternum.
Okay, what'd you get for your measurement?
0 to 85 degrees.
What if the patient couldn't lay down supine? What position do you put them in?
I do it in sitting. I'd stabilize them in their chair with their back up against as far as they could comfortably and make sure that they didn't compensate.
Okay. What muscles might you hypothesize would be tight if it was if muscles were limiting the motion? What muscles would you think might be limiting the motion?
Probably the triceps and the lats.
If it wasn't muscle that was limiting the motion, what do you think would be limiting the motion?
Capsule.
Okay.
Is that a pass?
Yeah.
So I will write that down. You guys don't get to ask that question, sorry. Oops. So in the clinic, I'd probably ask the questions like, does that hurt? You know, when you do that, does that hurt? And we go further than that. But any questions?
It will always be active or emotional when you're doing that.
You'll have to read your paper.
Okay.
It'll be a toss-up. Okay. Question for that. Some people were asking, you know, how do we know when we're done with our passive range of motion? At what point? Which is exactly why you guys need to know your end feels. Remember that? Firm, soft, hard. You're done when you get your end feel. Okay? Unless the person is told to stop midway or whatever. And then they'll kind of have to give you kind of a fake end feel on that. But for like external rotation, you know how it's kind of bouncy at the end? You push till you get a firm end feel. And that's your passive range. Does that make sense? Okay. Any other questions about that? Like as far as, like she faked a half range on me. So you guys may get some of that. And you may get some people that do full range motion. I think somebody asked at one point about the greater tubercle inflection. You know how it's kind of hard to feel sometimes. Depending on how bulky your person is, I can feel it on her pretty easily. But if you get in a panic and you know that it's the greater tubercle, but you cannot feel it, let's say you got someone who's pretty muscle bound, then you're going to pick the middle of the joint. But if he asks you what the fulcrum is, you're going to say, well, the fulcrum is greater tubercle, right? I mean, that's what you're going to do. Don't panic and go, I can't find it, and then the whole test is done, okay? Just do the best you can to find it, okay? able to feel a greater super call, especially on some of us thinner people. Am I?
And questions, just because you get questions, that doesn't mean you're tanking, all right? In fact, I'm almost the opposite. If I feel like someone's doing real good, if you can answer all my questions, a lot of times I just keep going until I can stump them. So, now,
So it might be a compliment.
yeah, if I think you're like trying to con me, then I'll come after you. But, so don't think if I'm asking a question that it's a bad thing, because it's really not. So we're just, we're asking questions, and probably I probably wouldn't ask that many questions on each one. I'll probably ask you one or two questions, and as we go along. So it's not, it's nothing to get real panicked about. And even if you don't know the answer, it may be something that I'm just seeing how much you know at that point. So don't get freaked out